Good afternoon, everyone. Today, as the Minister of Health, I am pleased to be here to publicly launch the second edition of Health in Review, which represents an international comparative analysis of Bermuda healthcare system indicators. Health in Review is a comprehensive book at how Bermuda is doing compared to other high-income countries globally. These are the member countries of the Organization for Economic Cooperation and Development, the OECD, including the United States, Canada, Portugal, Switzerland, and Singapore. The trends highlighted in this report include health status, social determinants of health, the health workforce, healthcare activities, quality, access, and health expenditure and financing. Additional information is also provided on the demographic and economic context within which health systems operate. The findings of the Health in Review report will assist the Ministry of Health with policy developments and program planning as we monitor and improve the health of Bermuda's residents. The data found in Health in Review can also be of a benefit to other parts of government, private businesses, NGOs, students, researchers, and the media. The updates from the first 2011 edition will prove insightful to anyone with an eye on the performance of Bermuda's health systems. Overall, there are some indicators of which we can be very proud. However, conversely, there are some in which we have performed the poorest of the 44 countries measured. Let me give you a couple highlights of some of the key findings in this review. For example, life expectancy. Life expectancy at birth, on average across the OECD countries, reached 80.6 years, but in Bermuda has a higher life expectancy of 81.1 years, which is higher than the United States, Germany, and the UK, but lower than Canada, France, and Portugal. For comparison reasons, the United States life expectancy rate is 78.8 years. Bermuda's female life expectancy rate at birth is 84.9 years, and male life expectancy at birth is 77.3 years. And as has been previously noted, Bermuda spends more on health care per capita than Portugal, Canada, and the UK, but we're not living as long as those residents. There are many reasons behind that, but it's clear that we can and we should do better. Nevertheless, we're doing really well on smoking, as only 10% of our population smoke daily, which is one of the lowest rates in the OECD. And this is great news comparatively, though of course we strive to reduce that number even further. Heart disease mortality is also decreasing in Bermuda, as is mortality from stroke. Our length of stay in the hospital post-heart attack is now 5 days on average, down from 10 in 2007. In Bermuda, 13% of the population has diabetes, which regrettably is the second highest in all of the OECD, with only Mexico having a higher prevalence of diabetes. Hospital admissions for diabetes, on the other hand, are decreasing, which implies that those with the condition are getting better care, but their admission rate is still higher than the OECD average. Transport accident rates, unfortunately, amongst males are nearly 3 times higher than the OECD average. Unfortunately, we are seeing this playing out in the headlines all too often. In brighter news, female transport accident mortality rates are the lowest of the OECD, and on average in Bermuda, over 85% of transport accidents are motorcycle-related. Similarly, there is a sobering scenario with deaths due to homicides, where the overall mortality average in Bermuda is 5 times higher than the OECD average, mainly due to the increased mortality among males. This means that when males die early, and for this comparison, early death is defined as being before the age of 70, most are dying early because of external causes like road traffic accidents or homicides. Bermuda has the worst obesity and overweight percentage of all of the OECD countries, and you've heard me say that before time and time again. 70% of women and 79% of men are either overweight or obese. We are creating a national strategy right now to deal with this public health crisis, and we'll be holding a symposium on halting the rise in diabetes and obesity in mid-January of 2018. Although it varies, on average, Bermuda has a diabetes-related major lower extremity amputation rate around twice as high as the OECD average. We are only exceeded by Israel, Slovenia, and Malta. Fertility rates have not yet met replacement levels of 2.1 in the past decade, with the total fertility rate of 1.44 in 2015. Bermuda is below the OECD average of 1.68 and among the lowest fertility rates of the comparison countries. The population has decreased from 2010 to 2016, and there are more women than men. As the population ages and the birth rate stagnates, this has implications on dependency ratios and therefore will have an economic impact, not least of which on the cost of health care. In conclusion, what has stuck out to me with this review is that, as in many other countries, men's health needs to be improved. Men are dying more often from certain conditions than women, dying younger from external causes like transport accidents and homicides, and have a lower life expectancy rate. This is something of concern to all of us. In fact, this morning I had an opportunity to attend a free health screening sponsored in conjunction with the Bermuda Cancer and Health Center as well as the Department of Health, and it actually runs until 4 o'clock at the Hamilton Seventh-day Adventist Church to encourage men to get free health screening. And this initiative, along with Bermuda Health and Cancer's Movember initiatives, are things that we can all be doing within our community to help to promote men's health. So I encourage you all to have a look at Health in Review. It is a very comprehensive report, and it benchmarks the health and healthcare systems in Bermuda, and it can be very invaluable because it shows how we compare to other countries in the OECD, and it shows exactly how Bermuda is doing against those countries. Thank you.
Good afternoon.
Good afternoon.
You mentioned the obesity rates being so high here, and also diabetes has been a long-standing problem in Bermuda.
Yes.
When you're talking about a national plan for the obesity, does that bring into it the diabetes as well?
Yes, absolutely. And I'm glad you've asked that, because we have been working within the ministry on the obesity and diabetes framework, and a symposium will be held in January that will be open to the public as well, healthcare providers, to speak about some of the initiatives that will be unveiled through the ministry to deal specifically with addressing and trying to halt the rise of obesities and diabetes, as we appreciate that there's a number of chronic diseases that come from those two matters. So we are hoping to look at that in more detail. And the ministry has been hard at work gathering a lot of information from stakeholders and the like, and you'll hear more information about that. But that certainly will be revealed in January.
Okay, great. And the health review itself, how can the general public access that?
If you go to the government webpage, and you can actually type in health review, but on the government webpage, it's been launched and you can download a copy of it for yourself.